My name is Jegan Krishnan. I'm a professor of orthopedic surgery, and I've been doing joint replacement surgery for nearly 30 years. And it's my privilege to help you through your joint replacement surgery and speedy recovery. I'm just going to take you through your knee replacement surgery. The surgery itself takes an hour to an hour and a half to complete. Once you're asleep and anesthetized, there will be an incision made in the front of your knee that goes from just above your kneecap straight down to just below your kneecap. Once this incision is made, we will then expose the surface of the joint and then remove all the arthritic surface of the joint. And once we've done that, we will then cut the shape of the implant into your bone, and this allows the implant to then attach to your bone. So there will be a cap on the end of your femur bone, another metal tray on the top of your tibia bone with plastic in between. So this is pretty much a real replica of the joint that you'll be having inserted into you. So that operation takes an hour and a half. We give you some antibiotics during and after the surgery to reduce the risk of infection. And this implant is held against the bone with a special glue that has antibiotics in it. And that also reduces the risk of infection. So once the surgery is complete, we also fill your joint up with a lot of local anesthetic and medication that reduces the amount of bleeding from the joint. And again, this helps you feel comfortable after the surgery, reducing the amount of pain that you will have. We also insert a drain into the joint at the end of the operation. And the main reason for doing that is to remove any excess bleeding in the joint. And this reduces swelling and allows you to move a lot more easily early. After this, we put your leg in a special stocking that reduces swelling and bleeding. And there's an ice pack wrapped around that knee as well to again reduce swelling and pain and the amount of bleeding. You will also have the option of having a catheter inserted into your bladder after the surgery. And the main reason for that is to take any anxiety you might have to rush to the toilet after the surgery. So this is mainly for your comfort. After the surgery is performed, you'll then be transferred from the operating theatre to the recovery theatre, where the observations will be made by the nursing staff, and then you'll also have an X-ray taken at that point. And that X-ray is just to confirm that the implants are sitting in an appropriate position and there are no other issues with the surgery. You'll be in recovery for a period of about 1 to 1.5 hours, and once you're stable, you'll be then transferred to the general ward. And once you're in the general ward, you'll be in your room and transferred to your bed, and the nurses will take observations on your blood pressure and pulse, and they'll be monitoring how much drainage comes out of the wound drains. Within 4 hours after you reach the ward, the physio will come to see you, and what they will do is try and get you to stand and walk around your bed and some early movement. The whole idea around aggressive early mobilization is that it helps you recover quicker. It also reduces the risk of other complications, such as getting blood clots in the leg, developing pneumonias, and also developing pressure sores as well. So there will be some early push to get you moving quickly. We also give you a blood thinning medication to reduce the risk of you getting any clots in your leg as well. Your leg will feel numb when you are awake for the first 8 to 12 hours, and the reason is we've given you a block to some of the nerves that supply feeling to the knee joint, and this is to reduce the amount of post-operative pain that you will have. But it should allow you to still move your knee and walk around your bed. You will also be given oral medication for pain relief, and it's important that you take this regularly so that you can stay on top of your pain. So you should be taking them regularly rather than waiting for the pain to set in before you ask for your medication. And our nursing staff are very keen on making sure you get that adequate pain relief to keep you comfortable in that first period after the surgery. From that point on, you'll also be seen by our geriatric physician, who some of you may have seen before you come into surgery, and he will just check your heart and lung function and make sure that you are well recovered from the anesthetic component of your surgery, and they'll monitor you daily as well. Shahara, our nurse practitioner, will also pop in and see you to make sure you're comfortable and all your needs are met. And if you have any requirements at all, do not hesitate to ask our staff. So from that point onwards, it'll be daily routine of getting in and out of bed and walking around the corridor of the ward, either with a frame or a stick, depending on how comfortable and how stable you feel. The general recovery period is at around about 3 days. You'll be ready to go home, and we will organize a discharge plan for you to go home and transportation home if you need it. And once you get home, we will also organize nurses to come and look after you for 7 days. Our physiotherapy care will also commence around about that period as well. In terms of the general progression in your recovery, for the first 6 to 8 weeks, you will need some sort of walking assistance. And again, depending on your stability, either a walking stick or a frame. And then around about that 6 to 8 week period, you must probably be walking around without much need for assistance. And our physiotherapy program will kick in to make sure you've got exercises to strengthen your leg and improve your range of motion. Around about 3 to 6 months, you'll be walking reasonably comfortably without much assistance. And it's a variable period, somewhere between 6 to 12 months, where patients suddenly start to feel that their knee is something like a normal knee and it doesn't feel like it's had surgery. So that's your general recovery program. You'll be reviewed by our nurse to check your wounds at around about 2 weeks. There are no stitches to be removed because we use dissolving stitches, and you'll have a special dressing on that allows the wound to heal healthy as well. You will be seeing me around about 6 to 8 weeks following your surgery as your first post-op follow-up. By that stage, again, you'll be mobilizing reasonably well with minimal walking assistance. And then following that review, you will be seen again at approximately 3 months following that review. So somewhere between 4 to 6 months from your surgery. And if everything's going smoothly, that will most probably be your last visit.